PN 4006 Final Exam Test Bank 1 Newest 2026-2027 Actual Exam with complete questions and correct detailed answers. Question 1. PG1. PN 4006 Final Exam Test Bank 1 Newest 2026-2027 Actual Exam with complete questions and correct detailed answers, verified answers, already graded A+. Which of the following is the most common electrolyte imbalance? Select 1. A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypernatremia. A. Hypokalemia. A. Hypokalemia. Question 2. The nurse will be starting a new intravenous 4 infusion and needs to select the site for the insertion. In selecting a site, the nurse should do which of the following? Select 1. A. Start with the most distal site. B. Look for hard, cord-like veins. C. Use the dominant arm. PG2. D. Vigorously rub and tap the chosen vein. A. Start with the most distal site. A. Start with the most distal site. Question 3. The client is receiving an epidural opioid infusion for pain relief. Which one of the following is a priority nursing intervention when caring for this client? Select 1. A. Use aseptic technique. B. Label the port as in 4 catheter. C. Monitor vital signs every 15 minutes. D. Prepare the client for discomfort he or she may encounter. C. Monitor vital signs every 15 minutes. C. Monitor vital signs every 15 minutes. Question 4. A 17-year-old postoperative client is laughing with friends. Soon after they leave, he tells the nurse he is experiencing pain and asks for something for pain. What does the nurse understand about this situation? Select 1. A. Teenagers will try to obtain narcotics by faking pain. B. Distraction reduces pain awareness. C. Postoperative pain comes on suddenly. D. Clients who are able to laugh are not really experiencing pain. B. Distraction reduces pain awareness. B. Distraction reduces pain awareness. Question 5. PG3. Upon entering the client's room, the nurse discovers that the client is experiencing acute pain. Which of the following is an expected assessment finding for this client? Select 1. A. Bradycardia. B. Bradypnea. C. Diaphoresis. D. Decreased muscle tension. C. Diaphoresis. C. Diaphoresis. Question 6. A terminally ill client with liver cancer is experiencing great discomfort. Which of the following is a realistic goal in caring for this client? Select 1. A. Increasingly administer narcotics to oversedate the client and thereby decrease the pain. B. Continue to change the analgesics until the right narcotic is found that completely alleviates the pain. C. Adapt the analgesics as the nursing assessment reveals changes in client condition and pain. D. Withhold analgesics as they are not being effective in relieving discomfort. C. Adapt the analgesics as the nursing assessment reveals changes in client condition and pain. C. Adapt the analgesics as the nursing assessment reveals changes in client condition and pain. Question 7. PG4. The nurse consults with the primary physician of a client who is experiencing continuous, severe pain. In planning for the client's treatment, the nurse is aware of the principles of pain management. Which of the following is it appropriate for the nurse to expect treatment to include? Select 1. A. Focusing on intramuscular administration of analgesics. B. Waiting for pain to become more intense before administering opioids. C. Administering opioid with non-opioid analgesics for severe pain experiences. D. Administering large doses of opioids initially to clients who have not taken the medications before. C. Administering opioid with non-opioid analgesics for severe pain experiences. C. Administering opioid with non-opioid analgesics for severe pain experiences.